Welcome to the Student Resident American Academy of Developmental Medicine and Dentistry Week of Inclusive Health. We celebrate this week learning more about patients with IDD and celebrating and championing the progress we've made. My name is Alan Wong. I am the proud president of AADMD, and my background basically is I'm a general dentist. And when I went to dental school, we weren't taught anything about intellectual disabilities. We weren't taught very much about inclusive health. We were taught a skill, and we were taught how to do that skill very well. And it wasn't until a residency program that opened my eyes that there are populations that are in great need, the disparity of it. And so hopefully in your journey through education, whether it be dental, medical, allied health, or everything of that nature, you will be very good at your skill, but you'll also see that there are other people that need your attention as well. This week that we talk about inclusive health was originally what's called the R word campaign that you might have heard of. The R word stands for retardation or mental retardation. And the little background of that is that a young girl, 9-year-old with Down syndrome, decided that she did not like that terminology. It's hurtful. It's something that is used inappropriately, but it's a medical diagnosis. So this young girl named Rosa Marcelino basically championed this R word campaign, or this R-word awareness rather, and in 2009, Senate Bill 2781 was adopted by the Senate and then quickly adopted by the President Barack Obama at the time as law to change the word mental retardation into intellectual disability. So now we are celebrating that by reminding people, especially healthcare people, that the word is no longer a word that we want to use because it's a hurtful word. And if there's another word we can use, let's try to use that. So part of that is to not only celebrate the idea of not a word, but a feeling, a thought that these individuals who are in hurt and in pain need to be addressed. And many times they don't have a voice. They suffer and they're sometimes overlooked. And what we want to do in AADMD is focus, educate, and give experience to the new clinicians to be. So the student resident group has been that voice for many of those individuals. And we are so excited that we have a new group of clinicians who have the heart and to make changes, not only in care, but in the curriculum. I told you I was a dentist, and I'm sort of a recovering dentist, recovering restorative dentist rather. In my trade, we did a lot of fillings, we did a lot of extractions, and it came to me in my latter part of my year that we probably did too many fillings and too many extractions, and we didn't focus much on prevention. And my goal as an educator is to focus on prevention, especially in vulnerable populations, such as those with disabilities of all sorts. And in doing so, I make sure that people are aware of certain risk factors, not only their health risk factors, but in the dental risk factors as well. So many of these are extreme caries risk and periodontal risk. And I see an adult population, both in the clinic and in the hospital. And every time we have to remove a tooth, or that I see x-rays where there's multiple abscesses and pathologies, it hurts inside to know that people are living that way and suffering. And if any of those maladies or pathologies were in any of our mouths, we would be yelling, complaining, and trying to get care. Anyway, so the question was how I got involved with IDD community. It really was by accident. I did one rotation when I was in dental school where we did hospital dentistry and we treated patients that had disabilities in the hospital. And I thought to myself, what a novel way of taking care of someone in a comprehensive way in a very short time. And I didn't think very much of it. I went to my residency program, was exposed to some populations of developmental disability, although not a lot. And it made me think, why do these people have to suffer? Why are there so many pathologies there? And how come it's so difficult for them to get care? And by serendipitous chance, I was at a hospital where they were doing hospital dentistry, but they only had one dentist come in once every 3 months or so. And I mentioned the fact, I said, why are they only coming in once every 3 months? Is there not very many cases? And they said, wow, there's a lot of cases, and we can't find anyone to do this. And I said, well, I think I would be willing to do it. So they said, great. Next thing you know, I have 2 days per week, and having 2-3 cases each day, and couldn't believe the backlog of all these cases. And at the same time, I was very saddened the fact that a lot of these cases were extractions, not fillings. A lot of these cases were people that didn't get cleaning for numerous years. And this population that's living longer are more complex. They have comorbid conditions that were overlooked as well. So my heart was touched, and it changes your mind. And when I see that, I think to myself, I need to be that voice. I need to be helping in this crisis and situation. And when I'm teaching in dental school, I sort of bring that to the table as well. I challenge you to be that voice. I challenge you to not only take care of patients and take care of the skills that you're taught, but also teach others, teach other healthcare providers, and make them aware that they can also be a team player in this, because many people suffer in silence. And we need to help bring that silence to light, if you will. My suggestion to everyone is surround yourself with great mentors. I am so blessed that AADMD has many of my medical and dental mentors, as well as my allied health mentors. I learned so much from them and become more comfortable and confident. Every day is still a learning experience for me, and I'm blessed by that. There are many mentors I'm going to highlight, and certain people have made changes in my life. One of it is Dr. Steve Perlman, who sort of exposed me to Special Olympics. And this one man was able to create this change in terms of bringing attention to healthcare in an organization that was focused mostly on sports, Special Olympics. And it's a great organization, but Dr. Perlman was able to bring light to dental disease, basically, and overall health. And it was sort of started a chain reaction of us looking more at people and what the disparities of all their other health cares are, including vision, hearing, podiatry, physical therapy, medical, health, promotion, and all the other disciplines that Special Olympics has. And we've been able to help improve the quality of life with individuals. And I'm so proud that we're able to do that. Special Olympics has this motto. It goes like, let me win, but if I cannot win, let me be brave in the attempt. And that motto sticks strong in my mind, because when Special Olympics was born, the idea of an attitude, so celebrating what people can do, not what they cannot do, is really heartfelt. I think that it celebrates abilities, and it celebrates the attempt, the challenge. And so, let me win, but if I cannot win, let me be brave in the attempt, should be a motto that we all adopt. And in changing the word about winning, should be something like, let me treat, but if I cannot treat, let me be brave in that attempt. And I challenge you to be brave. I challenge you to be that voice, as we mentioned before, just like little Rosa Marcelino. And if a 9-year-old can bring change like that she has, which has created this week of awareness, that would be wonderful. It's sort of like a ripple in a pond. One little drop sort of goes on and on and on and on, and that's where we are as an influencer. So, Eunice Kennedy Shriver, if you will, the founder of Special Olympics, she had 2 words that really was the soul of Special Olympics, and it's I can. And that's what the athletes teach us when they go out there and they perform and they show us their talents, that they can, and we focus on that. And for people that say that, I haven't trained in special needs, there's no real special training about it. It's just learning, because you can take care of patients with special needs, healthcare and all. So in closing, I just want to say, let us be that voice for inclusive health. Let us be that voice, just like Rosa Marcelino, just like Eunice Kennedy Shriver, just like Dr. Perlman. That voice needs to reverberate inclusive health for all. And I hope that you enjoy this week. I hope you find yourself fulfilled in your career. And I welcome you to the AADMD. And I thank the Student Resident Committee for creating this week. Thank you very much. And I hope to see you soon.